So at that point, I says, okay, what is an LVAD? And I'm an engineer by education, an electrical engineer, and I understood the electrical side of the heart. And they said, no, we're talking about the plumbing side of the heart now. It's the blood flow, how the blood runs through the heart and everything. So they started explaining what an LVAD was, what it did. And it was somewhere in there that they said, yeah, we think we can go for it. We think you're at a point where we got you as strong as we can get you. Let's do it. Do you want to do it? My first question to them was, what happens if I don't? Because I was still very hesitant at that point. What would it be to put another device in me? Who am I becoming now?
Before I had the LVAD, I had a whole lot of problems. I used to stay in and out the hospital. I'd go in the hospital for a week, get out, go right back in, couldn't hardly breathe, get ready to try to walk, get real tired. And the last time I went in the hospital, somebody suggested that I get a LVAD, but I had to think about it a long time. And when I finally did think about it, I got it.
I couldn't walk 2-3 steps without stopping. I mean, it was that bad within that short of time. I was still trying to exercise while I was waiting for my recheck, and I was at my son's, and I would walk around the house. But each day I could tell it seemed like I was going backwards rather than forwards.
Me and her, it was mainly me and the wife talking about bad side, the good side. The good side get stronger, get better. I could be around longer for everybody. So we talked about it, and we agreed to have it done. And it was funniest thing about it, had it done May 5th, Cinco de Mayo. Kind of joke about that one.
We discussed the pros and cons of doing it or not doing it, not so much from her point of view, but from my point of view, which I think, thinking back on it, was a little short-sighted on my standpoint of what it would mean to her.
I mean, they taught my family, about it, and they taught one of my friends came and they taught them about it really well, and they probably asked more questions than I did, But yeah, they do well with teaching the caregiver, and if you still had questions after the teaching, I'm sure they'd do more teaching.
And she didn't know, we asked questions. I didn't know, we asked questions. So we learned about this whole situation together.
One time I was in the hospital, and Dr. Torrey came in there and was talking to me about everything, about the LVAD and about stuff like that. So I told him, no, I'm not ready for this. So one day they had one of the patients, the old patient, Mr. Doty, to come in, him and his wife. They came in, and Mr. Doty showed me his LVAD. And he sat down and he talked to me. He told me all the stuff that he couldn't do before he got his LVAD. Then he told me about the things he could do with his LVAD. And it all sunk in, and I got to thinking. And then once they came, I told them that I was ready. And they asked me, well, what changed, Miss Mays? I said, talking to Mr. Doty.
And they started explaining what my lifestyle would be, that I would probably have to be going to the hospital a lot more than I used to. It'd become a regular basis, and of the one place I do not want to be is in a hospital.
They said, that there was this pump, and they showed me, and they talked to me about it, and I really resisted. I knew people who'd had very bad heart attacks, and they were living without a pump, and they had very little heart function, and they were still out there, working without it. So I didn't understand why I wouldn't get better.
The focus was on me, and I felt, I've got to make this decision and everything. I discussed it a little bit with Betsy, but I really felt the decision was mine to make. It was my life, my heart, my body. And from a selfish standpoint, I said, well, I want to continue on. I'm not giving up yet. So I said, let's do it. And at that point, I started asking all the logical questions that an engineer would do. I want to know how it worked, what it did, where was it, how it functioned. You name it, I was asking them. The doctors sitting back on the bed, scratching their heads, going, okay. And they took the time of the patients to sit down and explain it. And I says, I'm sorry if I'm driving y'all crazy. They said, no, we love patients like you. We love people that want to know everything they can about it.
I know you're sitting, you may be laying there or sitting there, you're scared or you're crying, you're nervous, you're worried, the family. But once you get it done, if you get it done, it's going to give you the spirit to go forward, to do, especially if you have loved ones or grandkids or kids. You're going to tell yourself you could do it for them, but you're going to be doing it for yourself before you do for them.
I guess the biggest thing is you need to take this information, every bit of information you can gather from the doctors. From me, fire any question you want at me and I'll tell you. You need to ask my wife anything to really understand what that piece of the puzzle is. But ultimately, it is your decision. You don't have to get it if you don't want it. But understand what you're deciding you're doing. And that's probably the biggest advice I give them, is to make sure they're making their decision, not what the doctors tell them, not what their wife tells them, but what they are deciding together.
I think it's important to stay positive and that you can do it. And I think it's all a matter of personal decision. If you choose to let it rule your life, you know, it will, like with any disease.